Hi everybody, this is Matt. We're continuing our series on the cardiopulmonary system, and today we're going to talk about the left atrium. Lastly, we were working on the pulmonary veins, and they bring oxygenated blood back from the lungs to the left atrium. There are some basic structures of the left atria that play a very important role in both the output of the heart and in the prevention of hemodynamic problems within the heart and also outside of the heart. So one very, very, very important structure is the mitral valve, or as I love to call it in German, it's one of my favorite terms in cardiology. Das ist die linke Segelklappe, which is directly interpreted the sail valve. So anyways, a little bit of culture for today. So very important is that the mitral valve closes completely and has no leakage, such that the left atrium can fill itself completely to maximize the volume of oxygenated blood that will travel on to the left ventricle and then out to the body. That's a really big deal. A second structure that's very, very important in the left atrium is the atrial septum. That is the wall separating the left atrium from the right atrium. Some people, unknown to them in many cases, have a hole in their atrial septum, which, because the left atrium has higher pressures than the right atrium, causes some of the oxygenated blood to leak over to the right side of the heart when the left atrium is emptying into the right or into the left ventricle. And that's not good, because oxygenated blood is being pumped over to the right side of the heart only to go back to the lungs to get oxygen. We call that inefficient. So that's not good. And some people never discover that they have that because maybe the hole is quite small, maybe they never get an echocardiogram in their life, and they just live with it, never realizing that if it was fixed, that they could live more easily, maybe breathe better, have greater endurance in terms of activity. So, and that's one of the two areas of interventional cardiology that I'll go into in a whole different segment of these presentations on cardiac interventions, and that is the minimally invasive closure of atrial septal defects. So, and a third area of structures with the left atrium is the left atrial appendage, which is basically a sac at the top of the left atria, which really serves no useful role in the whole cardiopulmonary circulation, but it can cause problems. The left atrial appendage can be a site of the collection of blood clots in atrial fibrillation, and that's suspected, and research has been done into that, and it looks as if based on echocardiogram within the heart, that in patients with atrial fibrillation that there is an increased risk of stroke, and the source of that blood clot that causes the stroke appears to, or at least one source of the clot can be the left atrial appendage. So a second intervention that has been that is being done in Europe is the plugging of the left atrial appendage, again with a minimally invasive procedure and devices. And also in patients who are undergoing valve surgery, they are sometimes closing off the left atrial appendage such that they can prevent that any blood clots from the left atrial appendage could be a source of clots that could cause a stroke. So that is essentially the left atrium. And I will go on to the left ventricle in the next presentation. Have a great day.